Hi, Angela. Say hi to everybody.
Hi.
Hi, Angela. Hi, everyone. So we're glad that we have you here. So I'll pass the screen to you, and then you continue from here. All right? Is it
Thank
okay?
you. Thank you, Yo. Thank you.
Okay. Thank you. Thank you, Angela. Okay, Angela
Hi,
is going to share with us her testimony now.
hi,
So he's
everyone.
trying.
Hi,
Okay.
everyone. A blessed afternoon to you, all of you. I am actually very fortunate to be able to present today to do some of my personal sharing, um, and my journey with Ventros in the healing ministry. First of all, I would really like to, first and foremost, I would really like to thank the Almighty God who has created me, for giving me the grace of a second lease of life through this wonderful medical device. The Lord has also brought many good people into my lives, and I would like to give honor to my family who has supported me all this while in my journey to the recovery of good health again. And also, I would like to mention two very special people. My angel, a friend who has introduced me to this medical device, and also to Mr. K.G. Lin, the CEO of Ventros, who has really helped me to the journey of recovery. May God bless everyone that has journeyed with me. Thank you so much. Um, I just like to show to you that's my family here, and I'm so proud of them. Because of them, and because of people, the good people that the Lord has sent my way, I am now in good health. And I'll just share with you my journey. Um, in 2013, at the end, in December 2013, I discovered that I had actually um, third end stage cancer. And the prognosis for me at that time was not good. To tell you honestly, I should
Hi.
not be alive today. But today I am alive because of this really fantastic medical device that God has brought into my life. And I actually had three doctors operating on me. One is a colorectal surgeon, another one a gynecologist, and a vascular surgeon. It was a 9 hour operation, a very long operation, and some of my organs went off, the ovaries went off, the womb went off. Um, about 12 inches of my colon went off. And together with that, um, the surgeons also were chasing away lymph nodes that was infected by cancer, that was attached to the main arteries of my body, that the artery that lead to the heart. They were really slicing off the lymph nodes. So out of the 24 lymph nodes that was sliced off, 21 was infected with cancer. You can see the photograph there. I was 5 days in the ICU and then later on in the hospital. And that's my mother there who came to visit me to give me support. Um, After my operation, during my recovery from the operation, I went to seek a number of oncologists. I went to Singapore and in Kuala Lumpur here, in the Klang Valley here, I seek actually the opinion of a few oncologists. And so in February, I started my chemotherapy. It was actually, I would check into the hospital on the first day to do the intravenous chemotherapy. And for the next 14 days, 3 times a day, I would be taking oral chemotherapy into my body. And it's not a good feeling at that time. It's doing chemotherapy is really terrible. It really kills the good cells as well as the bad cells in your body. After a series of 6 cycles of chemotherapy, I also did radiotherapy for 30 days. And because the radiotherapy is targeted at the end of at the area of my colon there. So in that area, when you do the radiotherapy, it also dries up your urethra, your vagina, and it's not a good feeling, really. It's like cooking everything, And so because of the chemotherapy and radiotherapy, it how to say, I lost actually the feelings of the nerves. It kills the nerves too. So I lost also the feelings of my feet. If I walk, I cannot feel the ground at all. If you were to take a knife and cut my toes, I would not feel it. Is as bad as that. And it's not a good feeling because I can't sit long, and because a lot of the nerve has just is being affected. So you always feel tired, lethargic, and it's a terrible feeling. So in 2017, my good friend Christy actually introduced me. She said, "Angela, come and listen. She has found something wonderful. Come and listen to this medical device." I didn't believe in her at first. But then I saw her actually, she was a very weak person, but she has changed to be more energetic. I went to the office, and at that time, one of the directors actually presented the Ventros IM laser to me. And while I was listening to the presentation, I was also doing the therapy, the laser therapy. And guess what? I fell asleep during the sharing because my body was so tired and so worn out that it really puts me to sleep so that my body can heal itself. I told Christy, I'm so afraid, in case, it would trigger the cancer again, it would activate the cancer cells again. I then went to do a lot of research. I went in and I read journals. I was reading through, and then I told Christy, I'm ready now to listen to a second presentation. And when I went to the office, Mr. K.G. Lim was there to share with me on the goodness of this integrative medical laser. As I was listening to him at the end of the sharing, I asked Mr. Lim, "What would you recommend me? I am afraid. What would you recommend me?" And he says, "Angela, just use it and it will help you." And because of that words, that comforting word, no, just use it, it will help me. And I really, clang on to his words, and I used the medical laser, the integrative medical laser. And of course, each time when I do the therapy, I would just go into deep sleep. I would just sleep. It's, and then when I wake up, I feel actually like a breath of fresh air again, that, that I have so much energy again in me. And after using it for just 3 weeks, I told Simon, Hey, how come, now as I walk, I can feel the grounds. I can feel my toes again. Before, I can't even feel my toes. You see, the integrative medical laser has really healed and connected my nerve again, that I can feel again. And it's such a good feeling. And so, because, it has done so much goodness to me, oh yeah, I forgot to tell you that, for me, every 3 months, I would need to see my oncologist. I would need to see my surgeon, and they would do a thorough check on me, blood tests, and all the rest of it. And to my surprise, actually, the cancer markers, the various cancer markers in my body dropped. Okay. And for the CEA cancer marker is like 0.9. Ordinary person is like 5, and mine is 0.9. It's the point something, and it's really good. So in using this therapy, I also discovered that it actually gives a lot of oxygen into your cells and into your body, and it brings down the inflammation in your body. And cancer cells, they are really afraid of the oxygen. When there's enough oxygen, a lot of oxygen, cancer cells will just die. So for those out there who have who who is having an illness like me before, cancer, do use the medical laser. It would really help you. And hey, when I was well again, and also, I was so excited about it, and I cannot just keep my mouth shut. Every person that I meet, I would just share about this wonderful medical device. And when I regained back my health again, I also traveled with Ventros. And, in the first trip, I took my family, we went to Korea. The second trip, we actually went to visit the um, research, the cell research center, the stem cell research center in Korea, which is really fantastic. And in the third trip, you can see me there. I'm so full of life, enjoying what God has given me, new life again after using Ventros. And I use it daily to keep up with good health, to help my body recover, as well as expel all the toxin out in my body. Because when you do chemotherapy, it is all chemicals in your body, and it's all embedded in the various organs in your body, especially your liver and your kidneys. And this, using the Ventros IM laser, it actually helps to eliminate all the toxins out in the body and help my body to heal itself. I would also like to share with you my mother's story. My mom, um, on the 15th of November 2018, she had a stroke. My mom is actually, she has dementia, huh? So her brain has already shrunk, and and she had a stroke. And one early morning, my maid called me and said, Ibu, Mama tidak boleh cakap, tidak boleh bangun. And then I rushed down to see my mom, and Simon too rushed down, and then I tried to take her blood pressure, but we could not read it because it was too high. And my mom could not lift up her hand, neither can she speak. So, and Simon quickly rushed and took the IM laser and put 4 bars 40 minutes on her. We called the ambulance. Before the ambulance could arrive, my mom could speak and she could already lift up, her hands and her feet. She could lift up. But we had to rush her to the hospital. In the ambulance, the laser watch was still on her. But when we reached the hospital, they had to take it off because they had to do CT scan on her and do various tests on her. When mom was in the intensive care unit and high dependency unit, I actually brought in the iron laser and secretly used it on her. And I remember the professor told me, Angela, your mom, she would not be able to walk. Her recovery would be very slow. Her recovery would be very slow, and because she has dementia, the chances of getting for her to fully walk and to have full recovery would be difficult. I didn't believe her, but I trusted in the medical laser, the medical device that we have, and I used it on her. And you can see that this is after she has been out of the intensive care unit to the normal place. And video. Can you see? She can really lift up her legs. The leg that she is wearing the stocking.
Okay, the other one, the other leg, mommy. This leg, this leg, this leg. Good, very good.
You see, the IM laser gives her the energy in her cells, in her body to lift up her leg. And her hands is also affected.
1, 2, 3, 4, 5, 6, 7, 8.
I continue to do.
1.
I continue to do this therapy on her a few times a day in the hospital. And my mom actually stayed in hospital for a month because I wanted rehabilitation for her to be able to walk properly without any aid. One night my mom, she was calling the nurse and they did not come. Guess what? She climbed out of the bed and standing outside the bed, she could climb out of the bed. And that is really fantastic. And during her first session, when they brought her to the gym to do, to try to walk and all this, my mom actually walked back to the ward. And then the nurses were so excited, and she said, doctor, come, look and see. And they were clapping hands when she walked back to her bed. So this is really, truly, the IM laser, it would help for those who have got stroke or anyone who has just got stroke. Use it on them immediately, and the recovery period would be very, very short. And that's my mom. You see, she's back to normal. That was during Chinese New Year in January or February. I can't remember now. And she can walk without any aid now. She's not on any wheelchair or anything. The next sharing I'm going to share is about Auntie Jane. Auntie Jane, she went to the East Coast, Kuala Terengganu, and when she was there, she had a stroke. They brought her to the private hospital there, and when they did the CT scan on her, she had a bleeding stroke, and they didn't want to take her. So she had to go to they had to bring her to the general hospital in Kuala Terengganu. The ICU wards were full. the first class wards was full, and she was actually just put into the normal medical ward. My friend actually, who bought the IM laser, of course, left the IM laser in KL and did not bring it to Terengganu. And so she called me and asked me, can you come and help my mom? We need to bring her back to KL again. So I flew down on the second day. I flew down, and Auntie Jane was actually in coma. And I have to actually pretend I brought 2 IM lasers with me, and I place it. I do therapy. I think in a day, I did that day about 6 times therapy too. One on the affected area, and another one, on the other side. And of course, I cannot put it into the the nose. That one, I just put it on her forehead and also at her navel. I went to talk to the specialists, and they told me that, it's really life threatening. She would not be able to see because, the bleeding has gone very badly in her brain. And so even if she wakes up, she would not be able to see. And they say that her stage is very critical. And I said, I would like to bring her back to KL. And they say it's very dangerous. And there's no ambulance in Kuala Terengganu to bring her back. So I searched the net and I actually ordered an ambulance and also a trauma doctor from Johor Bahru who does international evacuation for patients. So the ambulance came the next day, and that was just about 24 hours, just about 24 hours when I started using the medical device on her. Auntie Jane woke up. She woke up and she could turn around and she could even leave her hands that was affected by the stroke, and also the legs. She was, and the picture there, you can see the middle picture is the trauma doctor there that was getting her ready to, bring her back to KL. And meanwhile, we got the doctor's team ready in Sunway. The specialist told me, in the first place, I had to pretend to be her daughter. The specialist told me, you're doing, it's actually of great risk. And she says, it's very dangerous for her to go back there. But I know when she has woken up, the IM laser, she has got out of her coma, and we really need to save her life. The ambulance arrived at 6 p.m. By 7 p.m., we managed to get her in. We cleared everything, put her in the ambulance, and then the ambulance arrived at Sunway at 11:20 that night. Guess what? I flew back. I had to fly back. I had to take a flight back from Kuala Terengganu to KL. And so guess what? The next day, when I went to the Sunway, she was, of course, in the ICU in Sunway. When I went to visit her the next day, she was up and smiling. The respirator was off her. And guess what? She could see. And this is truly amazing. When doctors say there's no hope for her, and she's up and well. And of course, she's still in she was in the ICU for a few days to ensure that she's okay. Auntie Jane, I forgot to tell you, she also had a lung infection. And that's why that kept her in the intensive care unit, because of her lung infection. Today, Auntie Jane is well. She can walk a few steps. She can walk, you know, but she is well, she can see. So, you know, this really, you know, even if a person has gone into coma, and if we really use this medical device to help, you know, them, they can come out of the coma. Auntie Jane's case is not the first case. I also had another friend's mother who was actually 98 years old. She had coma, she had stroke, went to coma, and on the third day, you know, after using the IM laser for 24 hours, she woke up. And on the third day, she was discharged out of the hospital. I would like to share with you Felicia's story. Felicia is actually my goddaughter, and she lives in Kuching. And Felicia she has this Myasthenia Gravis disorder. It's a chronic autoimmune disorder. When Felicia was 17 years old, in January, on the 8th of January, they discovered that she had Myasthenia Gravis. That actually affected her. Myasthenia Gravis is actually a defect in the transmission of nerve impulses to the muscles. In severe cases, it may result in total paralysis, of which she went into total paralysis, and it can also be life-threatening. In Felicia's case,
Angela, excuse me.
She could not move.
Angela,
Her whole body was jammed up.
Angela, we missed your screen. Angela.
I can't do anything about it.
Okay.
Yeah, please share your screen.
I'll continue on. Felicia, when she had this Myasthenia Gravis, she could not actually move. Her whole body was all jammed up. Her parents actually will have to carry her. She can't even move her hand. Her parents will have to carry her, put her on the bed, and even on the bed, she can't move. They will have to turn her. So she lost her mobility, and she was on a lot of medication. And in each month, her medication cost is about 20,000 a month. So, you know, in 2015, she went for the plasma exchange, and that didn't help her at all. She could not eat, she could not chew because everything is all locked up. And later on, they also did the IVIG treatment, which each treatment would cost actually, the cost is about 30,000 in each treatment. And that didn't really help also. They tried all the different, because this is really a rare disorder. They tried everything. So Felicia, actually, she was really, her illness is actually life-threatening. And the overall cost actually of a treatment to date is more than 1 million ringgit. So when I got well and I went to Kuching, and when I discovered that, I'll just introduce this and see whether it would help her. Usually, Felicia, at that time, as she received many treatment, she can stand, but she doesn't have the stamina. She could stand for just a while and then again she has to sit down. And she's on really high steroids and her body weight went up to 106 kilos. Today, she is 85 kilos. She has shed about 30 kilos of her weight off. So the using, the IM laser has really bring her back to normal life again. She's no longer on wheelchair. She can eat now, she can bathe now, and she can stand long hours doing cooking and even experimenting. So yeah, sorry. So the IM laser has really helped her. She was actually on 2 kinds of steroids, and each day she would take about 12 to 13 tablets of steroids a day. Today, she's only on 1 steroid, and it has really brought her to good health again. When medical science say that for Myasthenia Gravis, there's no healing, there's no recovery. But Felicia, she recovered from the illness. Of course, she is still, she's on the way to recovery, but she's normal now. And it is her dream actually to visit Penang. And last year, she went to Penang for a holiday, walking and enjoying Penang. Yeah, and that's actually the picture of our Felicia with her parents and grandmother and sister. So, my dear friends, nothing is impossible. When doctors say there's no hope, with this fantastic medical device, there is hope. Can you all see the picture now? Oh, okay. I would like, okay. I'd like to share with you on my friend Eddie. He actually has cellulitis and also osteoarthritis. Cellulitis is a common, cellulitis is actually a bacterial skin infection under the skin. Eddie has been in and out of the hospital on wheelchair, and his leg is really swollen, red and swollen, and it is like an elephantiasis leg if you see him. When I went to see Eddie, he was actually very down. He didn't have a will to live at all because life was so miserable for him. And I told Eddie, I have an answer to your problem. Why don't you just try? And Eddie said, no, nothing helps me. I've seen so many doctors, nothing helps me. And I say, Eddie, why don't you just try? I actually gave him the IM laser to use. 3 weeks later, Eddie, who can't really walk, who can't really put on shoes, he called me and he called actually Simon, and he says, hey, Simon, come, let's meet in a mall. And I was saying, how is Eddie going to get to the mall? And when we went there, he was wearing a shoes and he was walking without any aid. Before, he was actually either on a wheelchair or on crutches. But Eddie was walking and he was so happy. And he says, I can walk now without any problem. There's no pain now. So I actually have a sharing by Eddie, but right now, because of the technical problem, we may not be able to hear him. You can actually see how Eddie is, how energetic he is after, his body healed itself. And Eddie was actually really on high antibiotic dose and also on painkillers. But with our special Ventros integrated medical laser, it solved all that problem. He's no longer on any antibiotics or any painkillers now. Okay, can you all see? Oh, okay. I will proceed on to the
infection on my skin. My left leg became like an elephant's leg. It was uncomfortable. The doctors tried to heal me. The disease came. I took very heavy antibiotics. It left me. It came back. And then besides that, nearly 6 months to 8 months ago, my right leg, I was attacked by this disease called Osteoarthritis. That's an old man's disease. One night I got up and I couldn't walk. I was so miserable. I had to crawl to the toilet. I met my good friend Dato and Dati. I refused to talk to them. I was on a wheelchair. I was so miserable. Then Simon and Angela came to know about it. They said, come and listen to this talk. I said, get away, don't talk to me. I got no money to buy anything. I listened, and when it was over, I told them I want to buy one of it. I bought it. Simon and Angela loaned me the money. Diligently followed the instruction. I sleep on it. I put all parts of my body, put on my leg. When I first came, I told Simon and Angela, I can't walk up the steps. I had to take the lift. The second time I came to this office, I tried walking up the steps. I succeeded, but I walk sideways. Wow. Very good. Today I walk normal. Wow. In all the sickness, I have to take so much of medicine, antibiotics, painkillers, so much of painkillers. Today, I have stopped taking antibiotics for 3 months. Wow. And I am determined. I don't want any form of drugs or medicine to be taken. But I have kept away from the medicines for about 80%. I tell you, there's so much of things Ventros can do to help us. Once you're on Ventros, you can cut off many of the medicine. Why not? Yeah, why not? Invest in Ventros. And you have to be very technical when you talk to people. You have all kinds of people from the lowest to the higher. To the smart electors, you have to talk to them about costing because they don't believe anything good can come out of this world.
You can hear. Let it.
But I tell you, Ventros is something really very good for all of us. Thank you very much.
Okay, stop sharing. No, it's okay. Go on. Never mind, it's okay. Go on. Okay. Time is running short. I would just share on. Yes. Okay. As time is running short, I would just share on the goodness of the integrated medical laser plus the PeSaR. I actually Caleb, can you go
Yeah.
to the health restoration slide?
This one?
Health restoration slide, because I'm skipping the sharing because of time.
Can you see the screen?
I would like to share actually the goodness of the fantastic medical device, the integrative medical device, plus the PeSaR. I would recommend that we use these two together, and it will bring us health restoration. When we use the PeSaR, it will introduce more oxygen into our body and all the minerals and enzymes. And so when we combine these two together, it will really help us, our body to heal itself really better and faster. Next one. Okay, what is the integrative medical laser? What is integrative medicine? Caleb, if you can go to the next. Okay, the integrative medicine, it actually treats our symptoms. So it really goes really deep down to treat our symptoms. And it addresses the root cause of our illness. It goes in and it helps the body to heal itself. And it also produces long-lasting results. It addresses chronic problems. And most of all, it is safe, effective, and it has no side effects. When most of us, in modern times now, we would take a lot of medications, chemicals that the doctors give us. Like in my case, it was chemotherapy. Yes, chemotherapy would kill the cancer cells, but there are lots and lots of bad side effects. But with our integrative medical laser, it treats the whole person, not just the disease or the illness that we have, but it really treats the whole person. The next slide, Caleb. Okay. I would like to actually compare prevention versus cure. For those of you who are out there who thinks that you are healthy, or if you have not encountered any symptoms of any illnesses yet, please, go on an prevention mode. When you are on preventive medicine, it is easy, the cost is really negligible, and you live a healthy lifestyle, and you also have a healthy family, a happy family. But as in my case, when I had the illness, I suffered the illness, life was really a complex thing. It was not easy. Going for treatment is expensive, and the future is really uncertain. I do not know what lies ahead, and it's really frightening. And it was really stressful on the family. So for me, I would say prevention is better than cure. And in IM laser, it is actually preventive medicine as well as curative medicine. If you are healthy, please get one. Every household should own one. And if you already have an illness, let it cure your whole body. Okay. I would say that, in life, it is a must for each and every person to have your personal doctor with you, which is the integrative medical laser, the wonderful medical device that God has actually gifted to the world. And the best gift for you and your family is, to own this medical device. Please do not wait until when you have an illness.
Hi, Angela.
Yes.
I interrupt you. You still got 10 minutes, and then you have only 3 slides. I think you can finish it. I think some of them feel disappointed that you couldn't share all your
Okay.
testimonials.
Okay,
Yeah,
sure.
you
Okay.
only 3 slides. Yeah, only 3. Yeah, no problem.
Okay.
Just continue.
Okay, sure. I would like
Yeah,
to
start with
share.
Jenny's story.
I would like to share with you Jenny's story. Jenny actually has osteoarthritis, and as we age, osteoarthritis, a lot of us would somehow get osteoarthritis as we grow older. And in Jenny's case, it actually affected her cartilage. And as you can see, the two pictures there, one is a healthy cartilage, another one is full of spurs, bone spurs, when we have osteoarthritis. When I met Jenny, Jenny actually had her one hip replacement before. And when I, went to visit her in Mantaka, she was actually she was sitting on a wheelchair, not mobile. And she actually had just 10 days ago, she actually had an operation to replace her hip bone. And her skin was raw, it was inflamed, and the stitches was also very raw. And when I told, I introduced them to the medical laser, they immediately use it on the very day. And Jenny told me that, she usually would take Celebrex to kill the pain, but when she uses the iron laser, she doesn't need to use the painkillers anymore. And recovery for her was so fast. And she actually came to my house 2 weeks later. I was actually rushing to the car to see her, but she came out of the car walking without any aid. It's so fantastic. Healing was so fast. So, for anyone who has been through any operation, if you want quick recovery from the operation, I think the medical laser, using the Ventros medical laser, would help for quick recovery. Okay, I'll tell you a story about Jasmine. Jasmine actually has an eye stroke. For eye stroke, the retina or the arterial occlusions happens, there's a blood clot there, and then it prevents oxygen from getting into the cells in the retina. And because they don't get enough oxygen, the cells will begin to die, and eventually it will lead to blur vision and also blindness. In Jasmine's case, her eye was actually very blur, and the doctors say that she will have to go for an eye jab every month, and for each eye jab, it cost her 1,500 ringgit a month. Her brother, who also had an eye stroke, pays 5,000, for one injection. It didn't help her with her vision at all. And one day when Jasmine came to the Ventros office, and when she was doing the medical the therapy, she said halfway through she could see like a clouds clearing her eyes, and she could see, like her vision was better. And after using the IM laser for therapy for 1.5 months, when she visited, her eyes actually she regained her eyesight back again. And the doctors were really amazed at her and says, "Oh, you see," they said, the injection helps it, but actually it is the IM laser that actually helped her recover from the eye stroke. That now that the cells and the vessels into the the capillaries that leads to the eye is, full of oxygen and it's working again, and she regains her eyesight again. Yeah. So I would like to share a story on Adam. Adam, actually, he had Parkinson's, and he was really, his hands is always shaking. When he did the first therapy, and then his hands stopped shaking halfway through. After 15 minutes, the hands stopped shaking. And of course, he was very excited. He bought the IM laser and he used it diligently. 3 weeks later, his wife called me and says, "Hey, I'm going to send Adam and the medical laser back to the office, to the Ventros office." And I asked her, "Why, Mrs. Adam, why?" She says, the husband has been so energetic. He's chasing her around the house and he has become sexually active again. So can you imagine, a person with Parkinson, there is hope for them. There is hope for them. When medical science say for Parkinson's, you may slow it, but you cannot heal Parkinson's. But with this amazing medical device, everything is possible. Yeah, that's all my sharing here.
To ask something, I think I'll let him. SD, I'll let you ask, and then you please mute your mic after you're not using, or else you'll be pick out some noise.
I just want to ask you, when I wear this IM laser, is it wear in your hand and then plug in your nose, right?
Yes, right.
Yes, that is the normal therapy, the nasal therapy.
Wear in the hand first, then plug in your own nose, correct?
Yes.
Because now my eyes quite blur, so I don't know how to really. Is it you use it the correct way?
Yes, that's the correct way.
That's correct.
Yes.
Okay. Thank you.
How many times you use a day, SG?
One time, sometimes twice.
Oh,
Use it at least 3 times.
So 3 times
Not
a
enough.
day.
You makan ubat 3 kali satu hari 3 times a day. I'm
Can
very sure it will help you, and drink a lot of water.
I'm laser in my what you call my eyes, or just spray?
Not
Just spray.
encouraging. Not encouraging. Yeah.
Just spray in the hands. Normal
Yeah,
way.
yeah. Just wear normal way. See like this, and then put the nostril on your nose. After 15 minutes, then you shift to the other side.
Okay.
Okay. Right.
Thank
How long
you.
you have been using the IM laser, SG? How long?
I'm been using not really a few months only, because my medicine already less already. My high blood every day I eat one. So now hospital the doctor asked me to less it half.
Reduce.
Reduce
Yeah, that's
half.
great. That's a good news for you.
Then
Yeah.
my what do you call my diabetic take 3 times one. So now take only 1 time.
Oh, that's great.
Also reduce
That's
it.
fantastic result. Yeah.
Yeah.
Partly
So now
the eyesight blur, all these sometimes partly is due to diabetic. So if the diabetic problem solved, and then just now like Angela was sharing about Adam's the eye stroke. So once the capillary the blood flow through, then your eye definitely will
quite
getting better. Yeah, the vision.
okay. Thank you.
Use the
Okay, thank you.
PeSaR. Use the PeSaR too.
Yeah, use the PeSaR too. Yeah.
You have to use the PeSaR.
Your turn.
Yeah. Thank you very much, Angela. That was a very fantastic and amazing story you're telling, Now, I am a patient of, I suffered from spinal injury because I fell about 11 years ago. So I have got lumbar 4 and 5 affected me, So how do I have walking endurance lah? Yeah. So how would you advise me to use the IM laser? I have started using it for 3 months already.
Okay. I'll just share with you on spinal back. I actually have a friend who is not so old, but because of the muscle weakness and the spinal weakness, she walks about 90 degrees. So can you imagine 90 degrees walking? And it pulls her, her whole backbone down. And when she met Mr. KG Lin, Mr. KG Lin actually told her to use the IN laser at least 2-3 times a day. And also, to place the laser light along her spine, run it across her spine from the neck to the bottom of the tailbone, run it up and down daily. My friend actually, she did it. Sometimes she does it, sometimes she doesn't do it, but she's very diligent in using the IM laser. So when I actually recently, I have not seen her for like over a year. And when I met her again, she's walking straight. And of course, there is certain exercise that she needs to do to strengthen her muscles and to put up, her, to make her walk straight again. There are certain exercise, which, one of it is, I wish I can demonstrate it, but stand, try to stand straight along on the wall. Okay, straight along the wall, stand straight there, straighten up. Another way is also, to face the wall, and then your hands with your 2 hands, walk it up, straight up above your head, and so that you stretch up, that it can be, you stretch up your bones. And you can place the therapy, actually the medical laser at the neck there. It really helped her. And can you imagine when sometimes when I see people walking, especially old ladies, they're hunched back and back, but there is actually, with this medical device, there is an answer which the hospitals can't even do it. Wow. So this is truly a life-saving device. It really brings up your normal life back to normal again. Yeah, it really helps.
Awesome, fantastic. Thanks very much, Angela.
Okay, good. Thanks, Angela, for the answer. And then I give you some.
Talk more, Karib. Hello.
Hello.
Invite her back again to talk some more.
No problem. She's more willing to help us. Yeah. Wow. Okay, I just give you some tips on all these spinal problem, because before I went into Ventros, I'm doing something on spinal issue also. I'm quite familiar with this. Okay. And if that a person is old lady or old man, so one thing to check that whether is your spinal crooked or not. So when you lie on bed, you can sleep straight. That means that is a muscle problem, most likely. Most likely is a muscle problem. It's your muscle tissue. After you're so old, you don't have enough ATP. Okay, so you don't have enough energy that to strengthen it. So what you need to do, either you use IM laser, you can use 4-bar sign on your spinal, or you use laser comb. Laser comb will be another alternative, another good alternative for you. So I seen patient went and do some operation, waste money and